Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Stephanie Libs, and we'll be speaking on the biomechanics of breastfeeding. Dr. Libs is a pediatric and prenatal chiropractor in San Diego. After her own breastfeeding struggles, along with so many families in her practice struggling, she quickly has become the breastfeeding doc. As a self-proclaimed education addict and book nerd, she finally enrolled in a program to become an IBCLC, International Board Certified Lactation Consultant. In 2021, she launched a course for chiropractors to learn more about taking care of breastfeeding moms and babies. The course, called Infant Adjusting and Breastfeeding Assessment, is a short, easy, affordable course full of easy-to-implement techniques that you can use right away to significantly improve the breastfeeding relationship with mother-baby dyads. As a mom who struggled with breastfeeding herself and seeing thousands of babies in her practice, she can tell you this work is powerful. Whether you're already a pediatric expert or you want to be, you'll love this course. She also has a course for moms, and she'll be sharing about in the podcast today that supports moms in learning how to improve breastfeeding. She's been published in magazines, submitted case studies for peer-reviewed publication, hosts birth and postpartum workshops, and also hosts continuing ed seminars. For more information, you can find her on Instagram at Steph Libs or website cafeoflifesandiego.com. Hi, Dr. Steph. Welcome to the show. I'm very excited to have you on today.
Thank you so much for having me. I'm so excited.
Yeah. So today we're going to talk about breastfeeding. And I think what's powerful, I've done a lot of episodes on breastfeeding with lactation consultants over the years on Well-Adjusted Mama, but I want to put a lot of focus on the biomechanics, the actual alignment and muscle and neurological component that goes into breastfeeding, so that moms listening can really understand that there's a lot they can do to help support their dyad with having a successful breastfeeding relationship.
I love that. That's like, I could talk about that all day long.
Yeah. So you and I are two peas in a pod because we're both pediatric chiropractors, both working with lots of dyads in our practice and supporting families with breastfeeding through chiropractic adjustments. So I want you to just talk a little bit about who you are and kind of how you got into doing this.
Okay, great. I would love to. So I guess I'll start with a little bit of my story of I'm a pediatric chiropractor, like you said, but I also decided to become a lactation consultant. And so I'll give a little, history background of why I chose to do that. So I have two kiddos of my own. They're currently 5 and 3. And my 5-year-old, we had a really rough birth and a rough time breastfeeding. And I had a lot of support from my home birth midwives. We intended to have a home birth. We ended up transferring, and it was, lots of chaos that we didn't intend. And breastfeeding was definitely challenging, but we got through it and everything worked out fine. I ended up breastfeeding her for 3 years, got pregnant again. I tandem nursed for a year, nursed all through the pregnancy. And then I just weaned my son when he turned 3 as well. So I breastfed both kids for 3 years over the course of 5 years, if that makes sense. And my milk is still drying up, by the way. I'm like sore every other day. I'm still trying to dry it up. So I only say that because I'm so passionate about breastfeeding, and I just feel like it's been such an amazing connection point for me and my kiddos, as well as like all the benefits of the nutrients and the immune factors and all that sort of stuff. But through that time, I was seeing lots of moms and babies, seeing tons of families. And I had this one family come in, and they were like the ideal family to take care of. They came every single week. Mom got pregnant with her second baby. She was, really active and fit and planning this great birth. And she had a great birth with her first. And they were just the most ideal family to take care of. They loved coming in. They loved chiropractic. They would refer all their friends, and just like really lovely people. And so she had her second. The birth went great. Breastfeeding was going great. We checked baby like within a couple days of being born, and everything was going fine. And she and I had become friends. And about 5 months after the baby's born, she calls me out of the blue and she says, I don't know what to do. I'm crying. I'm in tears. Breastfeeding is so painful. There's blood in my milk. I don't know what to do. I want to stop. And meanwhile, she had breastfed her first for, I think, a year and a half or something. So I knew that this 5-month mark was not the stopping point she wanted. And so I was like, oh my gosh, what is going on? Come in right away. Let's check baby. At this point, I wasn't doing a ton of oral work and checking babies' mouths, but I decided to look in baby's mouth, and there was a pretty obvious lip and tongue tie that I had missed. And I didn't check it because everything was fine. Everything was going fine. When the baby was first born, she was breastfeeding fine. So I just didn't look. And so I said, I think this is lip and tongue tie. I wasn't, diagnosing or treating it at the time because I didn't know enough at the time. So I said, I think this is lip and tongue tie. I think you should go see our pediatric dentist and consult them about a revision. So she went there. Sure enough, it was definitely a lip and tongue tie. She got it revised. Everything was fine. We continued doing body work. And that was kind of my turning point of, okay, I'm checking every baby every time for this. Because things can change. And as babies grow, we know that their cranial system changes, their nervous system changes. And so it's super important that we check that. And I think as chiropractors, we have such a unique little niche of, we are typically seeing families on a regular basis. We're tracking these changes, and we're really staying with them throughout the course of their life. So, it's interesting. I've even started checking older kiddos for their mouth and their oral structures and cranial structures, in addition to getting them adjusted, because there is just so much change that happens as they grow. And there's so much benefit to keeping everything balanced. So that's kind of my journey of why I decided to become a lactation consultant, because that one baby just really triggered it for me, that I felt like I was really hungry for more information. I wanted to learn more. And as a chiropractor, the coursework came really naturally, because it was things I was already doing anyway. So that's really how I got into it.
Yeah. And that's a powerful story, because I feel like, I've been a pediatric chiropractor for 18 years, and I wasn't checking babies for this years ago, right? And I wasn't even doing work on their head. I was adjusting Atlas C1 down, and which helps, but it's not enough, right? And so recognizing that the whole cranial alignment and doing work outside of the mouth, inside the mouth, will impact how the baby's mouth opens, how the tongue moves, how the upper lip flanges to get a good deep latch on the breast or bottle. This is all like pretty basic biomechanics, right? But recognizing that things aren't sometimes moving as well in the baby's jaw. They could be very tight. There could be some birth strain or trauma that's contributing, or in utero positioning. So I'd love for you to talk a little bit more about how different types of birth can impact breastfeeding.
Absolutely. Oh my gosh. So this is probably one of the main things that I talk about. And we talked earlier, I just launched a course called the Course on Breastfeeding, and it's for moms. And it's basically like teaching all about breastfeeding from a very holistic point of view, from start to finish. And from start to finish, with the start, what I mean is birth prep. A lot of people think like you prep for birth and then breastfeeding happens, but really it's a continuum. And so it's super important that even when you're pregnant, or even in the preconception, time that you talk about a lot, is prepping your body, prepping and planning for the birth to optimize breastfeeding as well. And so I like to talk a lot about that because it's so important. And there are so many things that happen in birth that affect breastfeeding. And, we just very often compartmentalize it as like they're two separate events, but again, it's a continuum. So one thing that I'd like to talk to people about is the breast crawl. And it's probably my favorite thing to tell moms about. And when people see it, they almost don't believe it until they actually see it with their own baby. So the babies actually have, as you know, all the innate mechanisms, the reflexive movements to literally crawl themselves to the breast and latch on right after they're born. So, I typically tell moms, as soon as baby's out, baby goes onto your chest, or they should go onto your chest, given that there's no emergency. They will literally make all the movements to move their arms, push their feet, and push their way to the breast. They'll lift their head, they'll bob and kind of move their head around until they find the breast. And there are all these things that come together that make it happen. And it's so magical. So a couple things that happen when they use their feet to push against the abdomen, they are helping to constrict the uterus back down, which will clamp off on those blood vessels and help to prevent hemorrhage, which is like such an amazing thing that the baby is helping to do that. They'll also start to see and smell the breast. So the nipple tends to darken in color. The nipple and the areola tend to darken in color during pregnancy. And that's on purpose so that the baby can see it better. They can see best about 8 to 12 inches away from their face, which is the perfect distance when they're latched on to see mom's face for bonding. Again, it's no accident. And then the nipple also starts to give off pheromones and scents and smells of that milk so that the baby can find it. There's some evidence to also say the linea alba, which is that, linea negra, which is that darkened line that runs up and down the belly during pregnancy, is also one of those things that helps baby see which direction to go to get to the nipple. And so all of these things are in alignment to help baby latch on. And they don't need a whole lot of help doing it, which is pretty cool. So there's a lot of evidence that we know if we can get that breast crawl, if we can get a good latch within the first hour of birth, it sets up your trajectory for breastfeeding success going forward. The numbers are staggering on even supply issues. So we know that if you get a good latch in the first hour of birth, your supply for your entire breastfeeding journey is going to be easier. Typically, it's going to lead to a higher supply. So there are so many things that happen just right after birth or during prepping for birth that's super important. The other thing I really like to talk about is interventions in labor. And birth is such a triggering thing because it can be so traumatic and emotional and so personal and beautiful and crazy and wild. But interventions in labor can hinder or affect breastfeeding. And so I always like to tell people this because I had a medicated birth with my first when I didn't intend to, and it definitely affected breastfeeding for us. It doesn't mean that it'll negatively affect everybody, but there are some things to know. So, for instance, the use of Pitocin and epidurals are shown to weaken babies' suck reflex. So they might have a weaker suck when they come out. So that's really important to know because if you do have those interventions and baby's having trouble suckling, it could just mean that there are some strength exercises to be doing or just waiting until baby kind of clears out the medication from their body and is able to suck stronger so that they can gain more weight. So that's something I like to tell people. Look, if you're in the hospital or you're at home and your pediatrician or your birth team is starting to threaten formula, maybe it's not needed yet. Maybe they just need to work through the birth and work through, clearing the medication from their body so that they can have a stronger suck. The other thing I like to talk about a lot is IVs, which I recently wrote an article in Pathways to Family Wellness magazine about the use of IVs in labor. And so there's a lot with this too. So IVs, which is something that we look at as relatively benign. It's just an IV. It's just fluid in labor. No big deal. But what that can do is a couple things. So one, it's going to give you lots of fluid in the body, which can really make the breast tissue kind of swell a little bit. So it's going to be really taut and tight of a breast, which is harder for a baby to latch onto. That taut tightness can also constrict the ducts and the tubules so that not as much milk can flow out. So that's important to know for mom when it comes to the IV.
Did you know that there's an organizing app designed just for families? If you're starting to feel busy again, and I know I am, and your calendar is jam-packed with events and kids' activities, why not do yourself a favor and get Cozy? Cozy is the #1 organizing app that families use to juggle school schedules, practices, meetings, doctor's appointments, and even a workout or date night. With Cozy, you'll be all set up to know everyone's schedule, who's doing what, when, and where. And Cozy will even send emails every morning with the day's agenda. No more missed pickups or double bookings. Here's how it works. Cozy tracks everyone's schedules and events in one place with a shared, color-coded calendar. Cozy even reminds others about events so you don't have to. It's easy to get started. You can pull in events from your family's personal work and school calendars. And the best part, it's free. Just download Cozy Family Organizer from the App Store. That's COZI to get the free app today. I know I've been using it and I absolutely love it.
The other thing that happens when we have an IV in labor is it really plumps up baby. And there's lots of evidence about this on evidence-based birth website where they talk about IVs. And there's a big correlation too between the amount of fluid used in an IV and the effects. So the more fluid, the more potentially negative effects can happen. So the other thing that happens is the baby really gets plumped up. They're like a sponge and they just absorb a bunch of fluid. So now baby is born, they're going to weigh the baby and they're going to be heavier than they would be had you not had an IV. So that's important to know because in the first day or so, baby is going to pee out a lot of that fluid and lose more weight than they would without having the IV. So I see this pattern all the time. Moms come in and they're like, baby was losing too much weight, and so we had to give formula. Very often, it's just the weight of the fluid that they're peeing off in that first day, and baby is well within a normal range. So typically, babies will lose 7 to 10% of their body weight after birth. That's pretty normal. Any more than that, and the team gets concerned. But again, if there's an IV, if there were medications like Pitocin and epidural used, baby could have a weaker suck reflex. Mom's breast is taut and tight, hard to latch onto. Baby's super plumped up and then peeing out all that weight. And then everybody gets scared the baby needs formula or needs some form of supplementation. When really we know that is potentially dangerous. Giving formula in the first, couple days, couple months of life is risky. There is risk in that. Of course, it can save baby's life if it's really needed, but there is risk in giving formula. So, and it also hinders breastfeeding because if baby is sucking less on mom, it's going to reduce her milk from coming in. So again, leading to this cascade of needing more formula. So I usually tell people, make sure you get baby's weight at birth, but also get baby's weight at 24 hours old. Because if you have an IV, their 24-hour old birth weight is probably more accurate to what their actual birth weight would have been. And then you can take their weight loss from there. And very often when we recalibrate that, babies are well within normal and then they latch on, they're sucking, they're getting plenty of milk, and they're doing fine. So those are kind of my big things I like to rant about.
Yeah, and those are things that nobody's really talking about.
Yeah. Yeah. And I think it's really important because, in the hospital, they're really just concerned with, keeping baby alive, keeping mom alive, which is their job. And I totally understand that. And it's not to, put them down for that or anything. They're doing their job, But I think it's really important that we empower ourselves because there's so much benefit to colostrum and to that, the first milk coming in. And when we keep interfering with these natural cascades, it really hinders our ability to breastfeed going forward. And I just see it happen all the time. People get scared and bullied and pushed into doing something. And then, that interferes with their breastfeeding journey going forward.
Yeah. I mean, what do you think about nipple confusion? Like if a baby does need some formula, maybe that first few days of life, does it create challenges with breastfeeding?
Yes, for sure. And I think, I kind of have a little bit of a different view on nipple confusion. I think that I have seen nipple confusion, but I think more of what it is a bottle is always easier for a baby to suck on. Always. Even if you have the slowest flow nipple, it is almost always easier for a baby to suck on that. And so it's a lot more work at the actual breast. So I think a lot of babies start to prefer the bottle, especially when it's given early. And it's so much harder to get back onto the breast, especially if a mom's dealing with, pain or lip tie or tongue tie or even just the cranial bones being off and a tight latch and them being subluxated or misaligned in the neck, which is so common. So that's something that I feel like is super important to have your baby assessed by a pediatric chiropractor as soon as possible after birth, so that all of those structures can be optimized and they can more comfortably feed on the breast for both mom and baby more comfortably. So I think there is a lot of nipple confusion, but I think it's more of a preference of flow and ease. Yeah.
Yeah, the path of least resistance, right?
Exactly. They don't have to work as hard and they're getting milk just flowing down, and with a bottle, I typically really like to push paced bottle feeding, which is where you hold the bottle at a certain angle and don't let as much milk flow out. And you're really trying to mimic the flow of the breast, because what happens is baby sucks typically will latch onto the nipple, and then they'll have to work for the letdown. And then the letdown comes and the flow kind of starts to slow down, and then they'll have to work for another letdown, and then it'll come back up. So doing paced bottle feeding, you can kind of mimic that, but you really have to pay attention. I was at the playground yesterday and I saw a mom kind of sitting off to the side, and her baby was facing away from her and she was holding the bottle, up to the baby, and couldn't see what the bottle was doing, what the baby was doing. And so, I think when you are going to bottle feed, you really have to be present with the baby and try and mimic breastfeeding as much as possible. So that's something I work a lot with parents as well, is really teaching them the right bottle feeding techniques so that they can get back to the breast more easily.
And Dr. Steph, are there specific bottles or nipples that you recommend for a mom who's wanting to breastfeed? Yeah,
so I will say there are two bottles that I find have the most, success with parents that I take care of, and that, again, make it easier to go back to the breast. So the two bottles are the Dr. Brown's, which they have a glass version of it, which is really cool. I like the glass, so it's not plastic. And then I also really like the Komotomo. A lot of people don't like it because of the shape of it. I think it's the most breast-like thing, but I really think, I think it would be cool if we could make molds of our own breast and nipple and then make a bottle that looks just like us. Like a coolest invention. I'm going to go on Shark Tank one day with that.
3D printer.
Right? Exactly. 3D print my boob. So those are the two that I find people have the most success with. But I think, again, everybody's so different. And I know people who have tried every bottle under the sun and nothing has worked, or, people who have tried 10 bottles to finally find the right one. So I think, every baby's so different. But again, I always go back to paced bottle feeding. Paced bottle feeding is really going to help keep the breastfeeding relationship as best as possible, I think.
So that means the bottle is angled so it's not just going so fast into the baby's mouth? the milk?
Yeah. So not only that, there's a couple ways to hold the baby. So you want to make sure the baby is kind of upright at least a 45-degree angle. You can see the baby, connect with baby, make eye contact. And then you're holding the bottle. Typically, you kind of just let them suck on the nipple and with no milk flowing. So they're kind of sucking air. But again, if baby has a good latch and they've seen a pediatric chiropractor and they have a good seal on their latch, it should be fine. And then you slowly tip the bottle up to about keeping the liquid horizontal so that the baby really has to work to draw the milk in. It's not just pouring in their mouth. You do that for a couple minutes, maybe 6 to 10 minutes or so, depending on how quickly they feed. And then you're going to tip the bottle down again so that the milk is not flowing into the nipple. And then they're going to have to suck a little bit more, work for it, and then you tilt it back up again.
So it's almost like suck training.
It's kind of like suck training, yeah. And I mean, this is ideal. Of course, not every baby is going to fit into this perfectly because, some babies are just too fussy. You just have to feed them, or, there might be weight gain issues, so you don't want them to suck too much and burn calories sucking nothing. So, it's all a dance, but it's, again, making sure you're working with the right professionals who can support you in this and aren't just going to say, just give formula, just do this, just do that, and make it, quote, easy on you, when really putting them to the breast ultimately is the easiest thing.
Yeah. So, and I think I love that you mentioned the team thing, because like in my community, we have a breastfeeding team with the pediatric chiropractor, the lactation consultant, and then a pediatric dentist who's doing revisions as necessary for the, tethered oral tissues. Occasionally I have families come into my practice who identify the ties, tongue, lip, buckle, and they're not open to doing the revisions. They're just not interested in that intervention. So what do you have to say to those families where the ties are there, the mother's struggling with breastfeeding, but they're willing to come in for chiropractic or body work?
It's a great question. And I I feel like I'm a little bit fringe in the tongue tie community because I am a bit more on the conservative end of revisions. I don't like recommending it unless it truly is needed. And so,
and that's like, when is it needed, right? That is the golden question here.
Yeah. So I really look at the ties from a functional standpoint. And what's kind of interesting is I feel like in the breastfeeding community, there's not a whole lot of standardization of how to assess for ties. So I think going to someone who is really well trained and has seen so many is essential. So my take on ties is, if everything is functional, if baby is getting adjusted, doing cranial work, doing oral work, and things are balancing and getting better, then the tie might not be the issue. It might be that their palate is misshapen, their jaw is tight, they're subluxated, their cranial bones are out of alignment, and that's causing a bad latch and discomfort and trouble transferring milk and all those sorts of things. So typically what I recommend is we see baby for 2 to 4 visits, depending on severity of, mom's symptoms. If it's an obvious tie and she's really struggling to stay at the breast and it's really painful and she's getting damage to her nipples, and I assess it and like, revise, you got to go now. But ideally I like to try and get 2 to 4 visits under our belt, see how baby changes, and then refer for the revision if needed, because that way we can see if the work that we're doing is improving and making a difference. And then they're also going to be nice and balanced, and everything else is going to be functional and working, and their nervous system is going to be primed and ready for that revision to take on those changes. So that's kind of my take. You're probably
the pre-frenectomy work is so underestimated, and it's so powerful. I mean, I would say we get a good amount of patients coming in, babies coming in after the frenectomy for their first visit, and it's like, well, okay, I can still help and there's a lot we can do. But when I get to see babies before and after, that's where we get the best results. And the team recognizes that. So the LC and even the pediatric dentist will be like, a lot of times, like, try do some of this, even if, like, yes, you need the revision. Once again, revision is not a standalone thing, ideally. And stretching the fascia, addressing the alignment of the cranium and the neck prior to that revision is just going to optimize the results.
Exactly. Yeah. It makes such a big difference. I feel like, same, there are plenty of babies that I see for their first visit after the revision. And, there is a lot of work that can be done, but I love seeing the difference. I love seeing babies before they go in, working on them, and then they get the revision. And then the adjustments are just like so smooth after that. And there's so much improvement that happens. I will say part of my, hesitation on referring for ties too soon is that I do think that it's a commitment to do the procedure because of the aftercare and the stretches and all that goes into it. And I don't want people going into it with false expectations of, they're just going to get it revised and everything's going to be fine after that. So I like to tell people, like, the stretches are really important. They can be really tough to do, and here's how to do them and try and make it a little bit more pleasant. So I like to try and let people know that it's not easy. And it can be a little traumatic for not only baby, but also mom and dad. So just trying to be realistic with them and let them know what it's going to be like and what it will entail. And some people want to wait, and I always like to tell the story of, I have one mom who I met her when her oldest was a bit older. But her son had a tongue tie that went undiagnosed and didn't get it revised. And then he was a super picky eater, and he had a lot of trouble with sensory eating, textures. And so they got it revised when he was 2, and it helped a ton. And, now he's totally fine, but they really struggled for, a year and a half when he started eating solids. And so, I like to tell that story because that's kind of one extreme of it did have a long-term effect because she didn't revise.
Yeah, this is beyond breastfeeding, right?
Beyond breastfeeding, yeah.
Speech issues,
yeah,
posture,
yeah, a lot.
Airway.
Yeah. And then I have a lot of people who I see who, babies, they have a frenulum, and, we could say that it's tight, but everything's functional. Their tongue is moving exactly as it should. They've got a great latch, a great seal, no other signs of tongue tie. And so they choose to leave it alone and everything is fine. So, I have a lot of mixed families that I take care of. And in those situations, just because, from my point of view, just because a frenulum is there doesn't mean that it's tight and tethered. And so that's kind of I think the sweet spot that I'm still learning and trying to find and, make sure I'm referring for the tie when needed. And, it's very much a dance.
It is. And I think for some families, waiting is a great option. For some it's more emergent, but not always. And, but I've had some infants coming in and the mother at this point has already given up on breastfeeding. She's not going to nurse his child, and they still choose to do the revision. So, there's, because of all the developmental components, cranial facial structures, the palate being, narrow, impacting airway, sleep apnea, that's been a big part of my practice. So just recognizing airway is life. Tongue ties can be part of airway issues. And I've had, I had a 1-year-old in my practice that was choking on solid foods. They got his tongue revised and it was fine. So these are real issues. I mean, they're not necessarily common, but they're real. And I see kids with speech delays or speech issues, they get it done. But it is, so it's hard because this could be a family that mom might even say, well, I breastfed for several months and I didn't have any challenges with breastfeeding. And then yet these challenges occur later. And, possibly it could be harder to do a revision on an older child would be my guess, and stretches afterwards. But the truth is, I guess we just still don't really, it's not always an easy yes or no. I'm so excited to share with you a company I recently discovered called Kindred Bravely. It came into life in 2015 by Deanne Ackerson and Mama 2 when she couldn't find any comfortable or functional pajamas while nursing her second son. She decided to design her own, and this led to one of the best-selling pajama sets, the Davy Nursing and Maternity Pajama. As moms, we have to stick together, which is where Kindred comes from. And Bravely, being a mom can be super tough. It's not for the faint of heart. It takes a lot of courage, and that's where the name came from. At Kindred Bravely, they are devoted to making life easier for pregnant and nursing moms. From breast pads and non-skid socks to nursing bras and pajamas, Deanne creates every piece with comfort, beauty, and function in mind. And her designs have been recognized by multiple awards. Perhaps more important than her clothing is Deanne's mission to build a community of moms who support and celebrate each other. Go check out her website at kindredbravely.com and use the promo code WellAdjusted20 to save 20% off your purchase.
And I think a big part of it too is taking into account the parents' feelings on it. Are they ready to do this? Are they really wanting to breastfeed, and are they committed to doing the stretches? Then yes, let's go for it. But if someone's really on the fence, then, I like to kind of gently walk them through this of like, this is going to be tough, but you can do it. And your baby really does need this, or, whatever the case may be. So it's tough. It's a fine line to walk because, especially as a holistic practitioner, the last thing I want to do is put a baby through a procedure that's not totally needed. So I'm very, careful when it comes to ties. And, but like you said, there can be a lot of long lasting effects from an unresolved tongue tie that goes beyond just breastfeeding.
Right. Exactly. So talk a little bit about, some of the babies that you see in your practice and, when you see them, why you're seeing them. I know some of it's for breastfeeding challenges, but what else?
Yeah, that's a good question. So, oh gosh, we have such a gamut of things that we see. Like you said, the biggest thing is breastfeeding issues. A lot of, nipple shield use and transferring off the nipple shield and slowly working towards that. We see a lot of colic and digestive issues as well. Kind of controversial, but to see a lot of babies who've had vaccine reactions. So we see a lot of that. And
you're seeing these babies within a couple of days old?
Ideally, yeah. So typically we are, like you, a peds and pregnancy office. And so I typically get to see the moms throughout their pregnancy. And then we talk about, I usually say, bring the baby in as soon as you can physically walk in here. Or if you're having any breastfeeding challenges, right away. Luckily, I have a building that's, you can pull right up and walk right into. So it's not a far walk for moms. There's also a birth center right next door to my office. So I check a lot of moms in labor, or I'll go check their baby just, minutes or hours after birth. So ideally, we're checking babies as soon as possible, because if everything is balanced and lined up from the start and their, cranial structures are doing well and their nervous system is nice and balanced because we've removed any interference from the birth process, then everything just works better. So it's just like a car. It's probably a terrible analogy to use for moms listening to this because I know nothing about cars. But I do know if your car is in alignment, if you're getting tune-ups, if you're taking care of it, it's going to work better, right? So same thing. The birth process itself can be a lot of change for the baby. They're going from this like perfect aqueous environment to getting massive amounts of compression and then being pushed out a tube or taken out or pulled out or vacuumed out or surgically taken out. So it's a huge change, not only the mechanical pressures that are put on baby, but also just the change on their nervous system from going from that womb to the world. They now have gravity, they have air. Their lungs are moving differently than they were in the womb. So there's just such a big change that happens. And so that's why I recommend getting babies checked as early as possible. And so, so that's usually what I explain to people. And so very often they bring their babies in with nothing, quote, wrong. It's just that they know that it's a good thing to do.
Yeah, they're there for a wellness checkup. And to your point, that's typically the moms that we get to see during their pregnancy and now are educated and aware to do this, because people know right after birth, you have your pediatrician check your baby. But people don't necessarily understand that a pediatrician's training is not the same as a pediatric chiropractor's training. Both exams are important, right? The pediatrician's looking to make sure the baby is thriving and doesn't need any medical intervention. But they're not necessarily so concerned with alignment and stress on the nervous system to the level that we are as chiropractors. And we have the tools to correct that with our hands. It's safe, it's gentle, it's drug-free, and it's optimizing the computer of that baby. So the baby, all they have to do is sleep and poop and pee and eat. And if they're having challenges with any of those issues, then we need to check their nervous system, and that's what chiropractors do.
Yeah. Oh, I love the way you say that. That's like so spot on. Baby just has a couple jobs to do. We just need to make sure it's all.
That's it, man. It's so simple.
It's so simple.
But we see babies that are having difficulty feeding, and sometimes it's on the breast, sometimes it's even on the bottle. They're really struggling with eating. This is very important, right? This is like failure to thrive, life or death. Then we see babies that are just not wanting to sleep, which newborns, man, that's all they really practically do. And they're just constantly irritable and they can't get comfortable, and therefore they're not sleeping well. That's a red flag. Or they're not eliminating well. Another red flag. And I think sometimes, it's easy to be like, okay, this is all right. We can, and it's like, no, none of these things are okay.
No, you're right. You're right. We've got to see this regularity with babies. And so, yeah, that's one of the biggest things I think people, especially people who haven't been in a long time, they're like, we haven't been in a few months. Baby hasn't pooped in 4 days. So we knew we needed to get adjusted.
Right.
And then lo and behold, they poop, usually while they're still in the office.
Right. And, or, baby's not sleeping well. We adjust them. And they're like, oh, they took the longest nap after their adjustment. Yeah. We hit the reset button on their nervous system. And just like a computer, man, it shuts down and then it powers back up.
Right.
And it works better.
Yep. Exactly. Yeah. I always like to tell the story too of my daughter who was born. We were planning to have a home birth. After 3 days of labor at home, I called it quits. I tapped out. I said, get me to the hospital. I need an epidural. Which was the last thing I wanted, especially as a chiropractor and a holistic practitioner. The last thing I wanted was any medication or medical intervention, but I opted to go. And so, got an epidural and Pitocin and rested and was able to push baby out a couple hours later. And then, we're in our recovery room and they come in and do a million tests, and I'm still in labor land and tired and exhausted and, hadn't slept in 3 days. And, so they come in to do her hearing test, and they test her left ear. Her left ear was fine. They go to her right ear and she didn't pass. She says, okay, well, I'm going to check it again. Checks it again, didn't pass. She says, I'm going to check one more time, but if she doesn't pass, we're going to have to run more tests. And my mother-in-law was there, who's also a chiropractor, and said, can we adjust her first before you do that? And the thought didn't even occur in my mind to adjust my own baby. She said, can we adjust her first? And I was like, yeah, can I adjust my baby? And the tech was like, to your baby? Yeah. And I was like, yeah, it is my baby. Why did we even ask that? So I adjusted her.
You did, not your mother-in-law?
I did. Yeah. I wanted to be the first one to adjust her.
I was not the first to adjust my son. I needed, my brain wasn't functioning to do that.
After that first adjustment, then it turned off and I had other people adjust her. But so I adjusted her. I worked on her atlas. I worked on her cranial bones. She started moving her head and swallowing a little bit. And the tech said, oh, that's a good sign. She's swallowing. She's moving her head. And she checked her again and she passed the test right away. And so, to me, that's just a perfect story of like, there was something not connected. There was something not working and we just optimized it. It was just a little tune up and an optimized. And it just makes me think, how many times are things like that happening? And chiropractic is not suggested to these families. And it's something that is so gentle and so effective and really, really works. And we see it in our practices all the time. And it's still, not necessarily recognized by the medical profession. It's funny, after that tech tested her ear and she passed, she said to me, wow, that was amazing. Can you come follow me to every room in this hospital? I was like, I would love to, but I just had a baby, so no. But maybe next time, so it's powerful work, chiropractic. And, I wish it were more standard for every baby born.
I agree. Every baby deserves to get checked. Every new mom deserves to get checked for her alignment and optimize it. That improves her postpartum healing, and milk production and everything, right? Like, pregnancy and birth is intense on our bodies and it does create misalignments. And so, of course, women need that support. As soon as possible. Once again, after birth, we say, come on in, and we check the mom and the baby as a dyad. And then dads like to come in too, because they're like, hey, I'm stressed.
Right. I'm sure your practice is similar. Like, we are very family-centered practices, and even our payment plans are family plans. They include everybody in the family. So to me, that's really important. And like you said, it's, especially with mom and baby, it's a dyad. And I always like to say, 5 of our 12 cranial nerves, those cranial nerves that like keep us alive, 5 of them all have nerves that go to the mouth for feeding. So it's such a huge thing to keep the cranial system and the nervous system balanced through chiropractic care. And same thing for mom. We have nerves that run through our ribs that go to the breast tissue. So even optimizing mom's physiology to help baby breastfeed is super important too. It's all connected. It's all together.
It really is. And, even like that first 9 months after birth, the mom and baby are energetically very connected. So, sometimes the babies will come in first as the patient, right? Maybe I didn't see mom during her pregnancy and the lactation consultant refers baby in. But now I'm looking at mom and I'm like, well, you got to get on the schedule too, because it's like, I can't just work on your baby and expect your breastfeeding relationship to be optimized by working on half of the dyad, right? So it's like both need the care. And if mom had never been to a chiropractor, she doesn't necessarily know. She's like, well, I'm here to work on my baby's mouth and neck and head and, all of that. And they get that, but they're like, but it's like, it takes 2.
Right. Absolutely.
Yeah. Awesome. Well, Dr. Steph, any last thoughts you want to share?
Oh my goodness. Well, I guess just thank you so much for having me. It's such an honor to be on here. I do have a course for moms, like I mentioned earlier. So the best place to find, we're still working on all the techie stuff, but the best place to find me is probably on Instagram, Dr. Steph Libs on Instagram. And then just through the link in my bio, I have, links to the course for moms. And it's really, really thorough. And, it's just, and for any stage of your breastfeeding journey, it's really beneficial. And even if it's your subsequent baby or first baby. There's just lots of good stuff in there.
And I think that's important too to mention, like this could be experienced moms who've had a successful breastfeeding relationship and now second or third baby, it's a different relationship and there could be new challenges that were not anticipated because the first time was easy and it's like, okay, well, I know how to do this, but it's like you're starting from scratch.
Yes, that's true. Because for us moms, like we might have breastfed before, but that baby has not. So, just again, it's a dyad. It's new for one partner, maybe not the other, but the whole relationship is new. Yeah.
Awesome.
Yeah.
Well, thank you so much for coming on the show today.
Thank you so much. I am so appreciative. I'm so happy to be here and be on, and I love what you're doing. So thank you so much.
Well, I hope you enjoyed today's episode with fellow colleague, pediatric and maternity chiropractor, Dr. Stephanie Libs. She's quite the powerhouse. And if you're interested in learning more about how to breastfeed, any breastfeeding resources as a mother, including women that are pregnant in preparation for breastfeeding, you can check out the course she just created for moms. I'm going to have it in the show notes, but ideally it'll also be on her website at drstephlibs.com. And I hope you check it out.